All right, we should be live. Good afternoon, maybe good morning. We're 1 minute early. It is Tuesday, October 4th. Welcome to our VETgirl YouTube live event. Very excited to have our great speaker here with us, Dr. Adam Rudinsky. Many of you know me. I'm Garrett Pachtinger. I'm a critical care specialist and the co-founder of VETgirl. And then, at least in my top right corner, we have Dr. Justine Lee, our
Hey, everyone.
fearless VETgirl leader. As you all know, we love hearing where you are logging in from around the country and around the world. And many who've you've been here before, you're already starting to do it. We have New Jersey, Mexico, California, Portugal. Good morning. Welcome. I can tell you, I am logging in as I look out my window from behind my monitor of another rainy day just outside of Philadelphia and Pennsylvania. Dr. Lee, Justine, where are you logging in from today?
I'm based at a beautiful 72-degree St. Paul, Minnesota, and we are having a beautiful fall right now. So the perfect time to get some learning on before winter comes.
And Dr. Rudinsky, where are you logging in from?
I am right here in my office, right in Columbus, Ohio. You can see kind of out the window. I had to block it because we've got the sun too here.
Oh, that's awesome. And if you look at our list, we're getting hits from all over. Let's see, Vermont, Wisconsin, Taiwan. Welcome, Peggy. Yucatan, Mexico, California, Honolulu, Hawaii, Lebanon, New Hampshire. So Dr. Rudinsky, I did tell him we're going to get people from all over, not only the country and the world. And he was like, we'll see. We'll see. And we are showing them. So super excited you were all here. So please continue to go ahead and type in where you're from. Justine and I truly do get a kick out of your review after the fact, as we're focused on the webinar now. But we look after and see where are amazing people coming from. And for those asking about CE attendance forms, hold 1 second. I'm going to go to my normal intro just about now, and I'm going to drop all that knowledge on you. So here we go. So again, thank you to Dr. Rudinsky. Super excited to be talking about chronic vomiting, especially in our cats. And as many of you know, when we have an amazing educational partner, I wanted to thank Blue Natural Veterinary Diets, Blue Buffalo, for being here with us today. It's with their generous support, we're able to provide this completely free worldwide YouTube live event where we do get CE credit. So thank you to Blue for being here with us today. And as you were asking, so how do you get your CE credit? There's two general ways to do so. You don't have to do it right now this second, but you can if you want. Number one is most of us now have our fancy smartphones. So if you open up your camera app on your smartphone and just point it as I am on my screen to that QR code, it'll bring up a little link for me. And when I click on that link, I'm going to go ahead and go to that form and fill it out. The other way, if you don't have a fancy smartphone, if you type in that little web address is tinyurl.com/VG for VETgirl, and then today's date, October, so 10/04/22, it'll take you to that same form. So go ahead and either use that little URL, the website address we have on our screen, type that in, or use your fancy smartphone and use that QR code. And we will keep that open for 30 minutes after the session ends, which goes from 12 to 12:30 approximate. So 1 p.m. Eastern, we will close that down. And then usually within a couple hours, if not 24 at the most, we will email your CE certificate. The other thing that you should know, and this will be on your email as well, is if you use the same email that you log into the VETgirl website, now within a couple of hours, automatically that certificate is going to be uploaded into your credits dashboard. So you don't have to wait for that email and download and upload. We will link it automatically to your VETgirl account, provided you use the same email that you register with and your VETgirl login account. So upgrades, we are bringing them along, hopefully sooner rather than later, but that is a great one for you right now. As this is a YouTube live event, you should know at the bottom of your screen, if you click on that sort of a box, that open four-corner box, it'll make it big on your screen, full screen, so you can see absolutely everything. A couple more housekeeping things. We're super excited to keep expanding our VETgirl content. As many of you know, we offer small animal, large animal, leadership, practice management, nutrition, and so much more, as well as now we have 10 different VETgirl certificate programs, which are absolutely included as part of your VETgirl membership. So if you're not a VETgirl member, check out our website, ask us questions, definitely explore. And if you are a VETgirl member, we do hope you're taking advantage of these opportunities because they're included, not additional or extra, they're included in your VETgirl membership. If you were at our recent conference in Minnesota, right where Justine is in her backyard, we hope you had an amazing time. but we're planning already. I know things roll around fast. In August of 23, we are going to be in beautiful Scottsdale, Arizona. So August 10th through 13th, put in your PTO requests now before your colleagues do. Don't tell them I said that, but you're going to want to be there. You're not going to want to have FOMO and miss out. So if you've not been to a VETgirl conference before, you get treated like you deserve to be treated. Amazing swag, amazing meals, amazing lecturers, and I can keep going on and on. But if you have a colleague or friend that went to one, they'll back me up on that. All right. With that said, I know you're not here to listen to myself or Justine, at least not today. Again, super excited to have Dr. Rudinsky here with us. So Dr. Rudinsky, if you can give us a little background, what do you do now? What are your passions? And, then what do you want to talk about today? Please take it away. I'll pass it over to you. The floor is yours. And again, thank you so much for being here with us today.
Yeah, well, thank you. Hopefully everyone can hear me well. My name's Adam Rudinsky, and I'm super, super excited to be here. One, because I get to talk about one of my favorite things in the world, which is vomiting. Between that and diarrhea, if that's all that I'm seeing, I'm always happy. So I'm a faculty member here at Ohio State University in Columbus, Ohio. Research interests as well as my clinical interests all kind of revolve around gastrointestinal disease, pancreatic disease, and hepatobiliary disease. So this is right in my wheelhouse. And without any further ado, we'll just go ahead and jump in and start talking a little bit about what's going on. So one of the topics I want to broach in our time together today is really this problem of whether vomiting is really a problem or not. And as you'll see on the next slide, I picked one of my favorite quotes that I found online, right? And this is where, you guys are a really great group of people because you're coming to organizations like VETgirl for reliable information. But as we all know, out in the lay press, there's lots of things like this quote here that can mislead our clientele when we're out in practice. And you can see here where this website, askthecatdoctor.com, actually says there's a large range of normal when it comes to the frequency of vomiting, which is just not really correct. So on the next slide, let's go ahead and watch a quick video, and I want you to tell me exactly what is going on here. So watch closely. Here's the big finale. And boom, right? So now let's take a look at what this website actually reports as the final results. So if you read through this, and I'm not going to read all of it to you, it's essential that you kind of look at the one sentence that says it's very difficult to distinguish harmless cat vomiting for vomiting, which is actually a clinical concern for our patients. And as you see a ton of this information out there, you can see that it's very misleading, right? And our clients don't always acknowledge that. So now let's look on the next slide at a little bit of prevalence data for what is happening in these vomiting cats. And you can see in large study databases, up to 5% of cats coming in for clinical evaluation, this is healthy and unhealthy cats in these studies, actually have a history of chronic vomiting. So this is something super common, super prevalent in the breed. So what's really going on? Because that's our next question on the next slide, and what makes vomiting so common in cats? So let's look at that vomiting reflex. And you can see, or if you remember back to those days in vet school, vomiting can come from bloodborne substances, right, in the vomiting center, which is an interesting physiologic difference in the cat versus other species. And we can also see it from neurogenic activation and in the emetic center, with afferent nerves from the GI tract, as well as things like stress, sickness, anxiety, motion sickness, all playing a role. But the key feature here is vomiting is a reflex. And in the cat, I have listed here a bunch of the pathophysiologic differences that we already know exist in cats themselves. And if we take this a step further on the next slide, this translates to something where we need a lot of clinical information for treating vomiting because it is prevalent. So I just throw this in here as an FYI information on the drugs that have been looked at or proposed for vomiting in cats, including ondansetron and meropetent, which are my preference, as well as with some of the dose ranges that we're commonly using in these patients. So to kind of summarize there, vomiting is kind of a unique physiologic thing in cats. It happens really, really frequently, and because owners may perceive it as normal, we as veterinarians really need to be on the lookout so that we can intervene, because it may not even be disclosed to us as a problem. So as veterinarians, if we get that information, what should we actually be concerned about? Well, on this next overwhelming slide, you can see tons and tons of vomiting differentials. And a nerd like me, I took the time to go through a bunch of papers and textbooks and stuff and find everything I could that's reported with vomiting in cats. And the easy way to summarize this slide is everything, right? So we can also look at it on this next slide as the big offenders, right? The main culprits. And if I look at acute and chronic vomiting, we have a core list of things that repeat and come up time and time again in the literature for what causes these, right? Now, there is going to be some variability, maybe based on where you live and those sorts of things, where there might be differentials that are higher or lower on your list, but this is the core stuff that we're looking at. So when we evaluate these pets, there's a few things we want to focus on, right? So certainly on the next slide, we'll look at some core features like the severity of vomiting, right? Because this is going to dictate how I manage it as well as how I work it up. Because the severity is often correlated to the cause, as well as how aggressive those diagnostics need to be and how extensive my treatments are, right? I also want to focus on making sure I understand what that owner is telling me, because it's hard for us as veterinarians sometimes to distinguish vomiting, regurgitation, and cough, and this is extremely difficult for owners, right? In some studies on asthma, it's been shown that 10 to 15% of asthmatics actually come in as vomiters, right? So we need to understand that there's differences here, and we need to tease those out. So your signalment can also be helpful to you, right? So we think of infectious disorders, foreign bodies, more commonly in young cats, neoplasia and systemic disease, more common in our older populations. And we can also kind of play into those predilections to help us. And then on the next slide, you can see that the history is also something that's useful, right? Acute onset versus chronic. I'm going to look at that animal that has a 24-hour history of protracted vomiting versus the animal with 6 months of chronic vomiting very differently, right? And we have to remember that there's certain things like owners reporting foreign body ingestion that we see quite a bit in our clinical patients, even though 33% of the time foreign bodies aren't what's causing vomiting, right? Those are probably, in a lot of cases, owners just trying to help by providing any information they can. And then certainly systemic signs, hemorrhagic signs also may change the workup and the diagnostics that we do in any individual case. And then the last piece of the puzzle is that physical exam, right? We want to be thorough. We want to make sure we don't see something under the tongue. We want to make sure the rectum looks normal. The abdominal palpation is normal. I don't see any icterus or signs of systemic disease, to help us kind of titrate our pathway to be as efficient as possible. And ultimately, the goal with this is to what I call categorize my vomiting, right? Because those acute onset mild BAR patients may do well with just a kind of empirical therapy, supportive care, and if that persists, then pursue a little bit more. Whereas the more chronic it is, the more severe it is, or the more quiet or sick that animal is acting, the more I want to be aggressive about diagnostics and treatments. So hopefully that then in that second part kind of sets the stage to, all right, in chronic vomiting, now we're caring about this a little bit more. We want to pursue it a little bit more. We want to treat it a little bit more aggressively. So let's take a second to then look at some of these differential diagnoses. So infectious differentials, there's two in particular that I want to point out because sometimes they get forgotten about. The first here is Physioloptera. So for those of you guys that remember Physioloptera, this is also called the stomach worm, right? It's a small worm burden, meaning there's usually only 1 to 2 to 3 worms that sit there near the duodenal outflow, or the pyloric outflow into the duodenum. And these can really be difficult to diagnose because of the clear eggs on typical routine fecal floats. So this is something that for our chronic vomiting cases, it can be present. It's something I like to empirically treat for because it's hard to diagnose. And certainly one thing I want to avoid in my practice is I don't want to endoscopically diagnose a Physioloptera, right? So this differential hopefully serves as a reminder to get those empirical dewormings done for your patients. The next differential I want to talk about is Helicobacter, because this is actually a very complicated concept. And there's some people that are big proponents of it, and there's some people that are more less convinced of Helicobacter. So I think putting into some of the literature helps me put this into perspective here. True Helicobacter pylori, like is common in humans and associated with human gastrointestinal disease, has actually only been reported in 3 cats, right? So a pretty limited number of animals that we see with that. Now, what you'll see on the next slide is that what we see more commonly is something called non-Helicobacter pylori helicobacters. And that's a mouthful, I know. So you'll see it NHPH as an abbreviation here. These are very common organisms, and you'll see these on many of your gastrointestinal biopsies, right? Now, whether or not these are pathogenic in cats is hotly debated. And as the next slide kind of shows, the correlation between these types of species and whether or not it actually changes our histologic results is actually fairly poor. So when I look at Helicobacter as a whole, I actually don't have a lot of good supporting information. It's really limited to case reports and some screening studies to say it's there, but no real good mechanistic causative studies for this to be a high concern. So on the next slide, if I see a biopsy which confirms Helicobacter infection, meaning invasive Helicobacter species, in combination with marked lymphoplasmacytic inflammation and follicular hypoplasia of the lymphoid tissue, that is going to be the most likely situation for me to consider treating this. And as you can see from the treatment options here, it's a pretty aggressive option, and that antimicrobial coverage can actually worsen the stability of your gastrointestinal tract if it's not needed. So if you're treating for Helicobacter often, I encourage you to kind of think, is this really necessary? And if you are going to treat for it, ideally it would be with that biopsy confirmation rather than just the presence of organisms. So that's kind of my infectious differentials, just refresher for some of the things we forget. Another thing that I don't think we talk about enough in cats and vomiting is the role of stress. So you can see this quote that I really love from who I consider the godfather of FIC, which now is often referred to as Pandora syndrome. And it talks about how he changed from calling it feline interstitial cystitis now to Pandora syndrome. And because it's multisystemic, it affects multiple body systems. And as you can see in one of their studies, sickness behaviors are not exclusive to the urinary bladder. We often focus on FIC symptoms because of blocked cats and the severity of that. But actually, all of those same treatments, litter box management, environmental enrichment, etc., actually improved gastrointestinal signs like vomiting, diarrhea, and anorexia as well. Right? So I call this lovingly the real FIC, mainly just because I'm biased towards the gut over the bladder, much to the chagrin of some of my colleagues. But it's one of those reminders that the gastrointestinal tract is very sensitive to stress. And just like we see stress colitis in that German Shepherd that comes into your clinic, our cats are experiencing a lot of stress, and that can manifest through gastrointestinal dysfunction. So as a blanket rule, I manage all of my animals with environmental enrichment and modification because it can't hurt. Worst case scenario, it doesn't help, but it still improves the environment for that cat. The third section that I wanted to touch on is the role of the hairball, because this is another common thing that just gets tossed out there as, yep, we've got hairballs, right? So how big is this problem? On the next slide, what you can see is that the incidence is actually pretty common if you think about it. Over a quarter of animals are known to bring up hairballs. In animals, I mean domestic short hairs in this study. But what's interesting is that's not something that we see in wild cats, exotic cats, or even feral cat populations. It's pretty unique to the animals that are in our care. So who's actually affected in that 25%? On the next slide, you can see that there's some correlation a little bit in terms of numbers to how often it's brought up in short hairs versus long hairs, but still, it's kind of an everybody's problem. Any of our cats can have this. So on the next slide, we can see a little bit about some of these risk factors, right? If you think about what our cats do on a daily basis, they're often grooming, right? 25% of their awake hours can be grooming. And this can even increase with things like stress, anxiety, other diseases, dermatologic disease. And because of some of their unique GI motility, they may actually have decreased fur clearance as well. So when I talk about vomiting, I want hairballs to be included in that, right? Because one, I believe that it's still something that we can improve on, still something that I think a lot of cats would prefer not to do if I anthropomorphize them. And worst case scenario, it can cause consequences, vomiting or obstruction in different regions, which are important. Okay? So I won't spend a lot of time on it, but like I said, motility in the cat's gut is different than in other species, and once again can affect this as a problem for them. So what can we do? One thing that is probably the most, has the most evidence behind it would be the hairball diets, right? So these are diets that are typically going to be higher in fiber. They're going to be typically have an altered kibble size and potentially treating underlying gastrointestinal diseases as well. So the overall evidence isn't super strong, but that's our best bet. Everything else that we often recommend, hair control, changing feeding frequencies, lubricants and laxatives, and even prokinetics have not panned out in studies to actually show a major benefit. So what I encourage us to do in the hairball world is, make sure we're asking those questions about it, and then evaluate those animals just like you would any other chronic vomiter. Dietary therapy should be pulled into that kind of treatment planning, and certainly be cognizant that this animal may have underlying GI disease or stress disease or something else that may be a component. And it's not just merely something that owners acknowledge as another kind of random thing that my cat does because it's a cat. So the last big section is because this is the most prevalent diseases, which for our chronic vomiters is chronic gastrointestinal inflammatory diseases or our small cell lymphomas. And you can see we're all pretty commonly familiar with chronic enteropathies, often considered like inflammatory bowel diseases, as well as the gastrointestinal lymphomas, both small and large cell, and the small cell that we see more commonly. When I break down on the next slide what's happening in the gut, right, we can think of this in three different sections, and this is correlating to how we treat animals. So what's in the environment? Well, that's that dietary component. Who's living there? That's the recent focus on dysbiosis and fecal transplants and probiotics. And what is the immune system doing in these animals? And those are the animals that sometimes need steroids or cyclosporin or other medications like chlorambucil to get things under control. But all in all, chronic enteropathy is often called inflammatory bowel disease. And I'm going to put the emphasis here on diet for one reason. Because if you see here on these percentages, diet is actually a major treatment player in our chronic enteropathy cases. Up to 60% of these chronic enteropathy kind of IBD type cases are going to be food responsive, right? So it's a great tool and something in every GI cat, every vomiter cat that we want to be considering. So on the next slide, you can see that we have kind of an overview of kind of how we would typically approach the chronic vomiter from an IBD standpoint, which would be your diagnostics across the board. And then you usually start with diet, maybe some microbial management, and then steroids. And obviously this is kind of the traditional approach, the average approach for any individual animal. And it's going to need to be tailored to your individual pets as well. But it warrants taking a little bit of a deeper look into that dietary question. So on the next slide, you can see the three core types of diets that I'm going to be reaching for when I'm looking at a gastrointestinal case. Right? So hydrolyzed and novel protein diets are kind of the mainstays of gastrointestinal disease chronic management, right? We know this from dogs and we know this from cats. We don't have good head-to-head studies on this, so we don't know which one is better, but both are reasonable options for a chronic vomiter. Hydrolyzed diets like HF here, shown by Blue Buffalo, have a few nice benefits, including things like a higher digestibility than the parent proteins that also give it an easily digestible angle. And certainly the novel protein diets may have a benefit in some of our allergy cases, which are a minority of our chronic vomiters, but still an important component. The other unique thing about cats is they actually have also a really good response rate to easily digestible diets. So this would be like GI support here from Blue Buffalo or EN or Royal Canin High Energy or Hills ID. Those types of diets also have a good response. So all three of these can be really, really useful options for your chronic vomiter patient, depending on your overall dietary goals. Okay? Now, on the next slide, I also lump into this fiber-based diets. And I think we always want to consider these in cats. I do stick away from them for my chronic vomiters. And I pulled these out because there is good evidence for them. It's just this is usually much more useful in your diarrhea cases and actually may worsen some types of chronic vomiting outside of maybe, say, a hairball type vomiting problem. So diet's a super, super important component, and cats really respond quickly to diet. Within a few days, if you have a food intolerance, which is the majority of our cases, you're going to see a response to dietary therapy if it's going to work. In food allergy cases, which is a minority of your cases, those animals will take the traditional dietary response time of 2 to 3 months. Then the last section I wanted to point out and provide some doses for are the other drugs that we're using, right? So we're not going to dive into the microbe management quite as much in the main talk, but with the drugs, you can see that corticosteroids are typically the mainstay, whether that be prednisolone or whether that be budesonide. These are reliable and faithful medications that can be really useful. These are kind of my starting doses here, and then I work back from there. And then on the second slide, still my preferred secondary agent would be the alkylating agent, so chlorambucil. I've had really good success with this. I've had really good tolerance with this. There's different dosing schemes. The 20 mg per meter squared every 2 weeks is actually really wonderful for a lot of cats that are hard to pill. But you can also do the more traditional dosing scheme as well. And I like these two options because they both have a lot of data behind them compared to some of our other options. This doesn't mean you can't use drugs like cyclosporin or other things. It's just I tend to like to start with the things that we have a little bit more evidence for. And in those instances where you may not have a biopsy confirming small cell lymphoma versus IBD, having that alkylating agent may be more effective in those cases as well. So that kind of puts together everything in terms of a crash course on chronic vomiting in cats, hopefully provides a little update and refresher on kind of our approach and how we look at these guys, as well as some of the core things that should be on our radar to screen for and consider when we're talking about managing these patients.
That was fantastic. I love that huge differential list of all the differentials for vomiting.
Not daunting at all, right?
Right? That's why it confuses veterinary professionals, because there's so many differentials out there that we often forget about. All right. Well, first of all, just a huge thank you. A fantastic presentation. I absolutely love these 30-minute ones over breaks. A lot of questions. I also wanted to give a huge shout out and thank you to Blue Buffalo for bringing us today's free VETgirl YouTube live event. Just in case you forget, don't forget to fill out that QR code right away, because we want to make sure that you get CE for this. Again, that's going to be for 30 minutes. And keep in mind that's that certificate is going to be closed, or that survey is going to be closed in about half an hour. So you definitely want to make sure to fill that out. For VETgirl Elite members, keep in mind you can always go to our website to be able to watch it to get non-interactive CE for it later. And I just dropped the QR code, a URL or the tiny URL directly right into the chat. So again, please make sure to fill that out right away. All right, Garrett, we can banter back and forth, but I see a bunch of questions out here. So again, great information. A lot of things I didn't even think about. Now, First question, any alternative if cisapride isn't available?
So yeah, I think there's a few different options for prokinetics if you don't have cisapride available. The nice thing is we've hit a good spot where cisapride from compounding pharmacies is a lot more reliable these days. The tough part is our options are dwindling, right? So erythromycin has same availability issues, but may have some motility properties. Metoclopramide, probably better injectably than it is orally, but also another option to try. Ranitidine has a prokinetic effect as well. We don't know how well that works in cats, but something that historically I would try. But once again, Zantac and that drug haven't had the best press in the last few years, being taken off the market in human use. So the other drug that I'll sometimes reach for in my cats is Mirataz. Once again, it's not necessarily well documented in cats, motility effects. Those are documented in dogs, though. And as I mentioned in the presentation, there's species differences. But that's a really good drug. The pharmacokinetics are really nicely mapped out in cats. And I think subjectively, worst level of evidence, right? But my personal opinion is that I do think sometimes it helps with motility as well.
Wonderful. Thank you. All right. Any human tests? I know we could do like a 2-hour webinar just on Helicobacter, but can human tests ever be used to test dogs and cats for Helicobacter?
Yeah, another really fun question. So I think if I tried to do that study, I would probably be mauled by the cats. So a lot of those are reliant upon exhalation tests where they're testing the actual breath in the exhalant for properties and stuff like that, where it's kind of like respiratory testing in general. It's functionally hard for our patients to be reliably doing those sorts of things. So we typically often have to rely on that biopsy confirmation, which I fully understand is not always attainable. My point is just, if you look at proportions with that disease, you're going to see a ton of chronic enteropathies for every potential Helicobacter. And if you give a chronic enteropathy a bunch of antimicrobials, you may actually worsen those chronic enteropathies. So at best, it should be a last resort, or if you have those biopsies.
All right. Okay. So you brought up the great point, biopsies. In real life, it is so hard to convince dog and cat owners to biopsy. Sometimes it's hard to even get that ultrasound or that further diagnostic workup.
Mhm.
So great presentation in that we as veterinary professionals are way too accepting and tolerant of chronic vomiting in cats. And again, it does warrant that workup. So if diet therapy doesn't work, when is it appropriate or is it inappropriate to reach for immunosuppressives without intestinal biopsies?
Yeah, great question. Can we just start the clock over and do 30 minutes?
Exactly.
So that's a very interesting question. My answer, and you're not going to, like, not everyone agrees on this, but I would say always, right? There's fairly low risk if you are educating your owner appropriately, right? So every single thing we do every day has pros and cons, risks and benefits. If they understand the risks, proportionally speaking, if you have even just general blood work ruling out systemic disease, your most likely differential is going to be a chronic inflammatory or chronic neoplastic process, right? Proportionally. So epidemiologically, it makes sense to use that as an empirical management option. And I say go for it if you educate your owner that there may be worsening of signs if we're on the wrong path. I actually don't even biopsy all of my own animals. And it's kind of a tricky question, because what I would tell you is if it's my own personal cat, yes, I scope them immediately. But that's because I'm an anxious internist with, just general nerves. But once again, the majority of the time, what we're scoping for doesn't change the way I manage an animal, right? Even if I find lymphoplasmacytic inflammation, which is the vast majority of the time, I'm still going to treat empirically with diet, and then with maybe probiotics or fecal transplants, or then immunomodulatory. So the thing doesn't change. And then the last point I'd say to that is there's also some recent literature that shows the even healthy animals can have inflammation in their gut. So there's a lot of complexities to biopsies and their interpretation in general.
Yes, I hate that lymphocytic, plasmacytic. Oh,
Yeah.
right.
No matter where you look, you'll
I
find
do
it.
emergency critical care, not internal medicine. All right, we'll take one last question. So you brought up some great points of ideally, yes, we want those intestinal biopsies. We want to consider that diet change probiotics and then do it stepwise. Anything that you recommend, like is that the particular step that you want in order prior to biopsy? So deworming prophylactically first, trying a diet trial slowly first. What are the like last 3 tidbits that you can leave us when it comes to those 3 steps to take before the owner really needs to be convinced to do that abdominal ultrasound and that endoscopy?
Yeah. So I would say in general, right, for an owner that you don't have financial limitations and they want to be aggressive, it's always best to do all those diagnostics up front, right? Because in the small percentage of cases that you say have a large cell lymphoma, that's going to change your prognosis and all of those things. But if you overall have that stable BAR, I've been vomiting for a year, statistically speaking, in that group, you're going to be seeing those 2 things. Diet is by far going to be the best for that animal, in my opinion. They need to eat. That's no big shocker to any of us here. If I can do that with a complete and balanced diet that solves their clinical signs, it's my best chance to avoid adverse effects. So that's why I put that first. In terms of managing the microbes, you should never really expect a massive effect with that, right? A probiotic's not the panacea. So those are usually adjunctives. So I'm pretty comfortable adding them in, but I don't put a lot of reliance on them. And then I go to the steroids after that. Any of those in that trajectory is really just built on safety of the treatments, in my opinion. But that's the reason they're ordered for there. And then regardless, if your owner declined that diagnostic workup early, that's fine. You can always circle back to it and do it later on in the diagnostic process.
Wonderful. Thank you so much. It's actually interesting. I'll leave on this anecdote. My own cat was occasionally vomiting. I was very tolerant of it during my residency. And darn it, I live with an internal medicine resident. And he was like, you need to work up your cat vomiting. I was like, meh, it's only once or twice a month. He's like, no, it's not normal. I was like, all right. And I did actually try probiotics, and chronically he did really well, and it did minimize the amount of vomiting. So great information. Thank you so much. Again, a huge shout out to Blue Buffalo. Don't forget to fill out your survey. We already put that in the chat several times. So you have to fill it out within the next 30 minutes because then you're cut off. Okay. We just need to confirm that you're watching it live. And again, we will see you on the next YouTube live event or the next VETgirl webinar. We pretty much have a webinar every Sunday through Thursday, so don't miss out. And Dr. Rudinsky, thank you again so much. Awesome, awesome job. Loved it. Thank you so much, everyone.
Thank you, guys.